having been to New Zealand a dozen times.
Yep.
What's the end game, in your opinion, and you may not have one,
Right.
what is the end game in New Zealand?
I think massive social control that's going to be used for the climate change issue. I think what's going to happen is that climate change is going to be framed in terms of public health, and other things that seem tenuously related to public health will be framed in that way. Because remember, the argument is that you have to do this for the good of other people. Well, you can frame a lot of stuff. You can actually frame lockdowns for the flu in those terms too. And so I think, I think in New Zealand, I mean, it's a couple of islands. Same thing with Australia. The type of social control that's possible there is different from the type of social control in the United States. We've got this massive continent-wide country, and so I think that's what's happening. I honestly think they're sort of testing the waters for, okay, how much can we control the population for future aspirations.
Anyway, I agree with what you say. The question is, though, how do they start bringing outsiders in? What is the end game?
Well, again, New Zealand, as I mentioned, Australia has put the army into the streets, but the reality is that people are basically complying. I mean, all of these things, they don't require violence. It just requires simple civil disobedience. The problem is that people are not yet at the stage where they're willing to simultaneously refuse to comply. So individual people, right, that are usually sort of somewhere on the spectrum and are willing to do things that are contrary to social, sort of signals, they'll do it. But if you're one person not wearing your mask on the plane, they're just going to throw you off. It's completely ineffective. And so what has to happen is that people have to simultaneously decide that they're not going to comply, and then it's simply unenforceable. And most places have not yet reached that stage, unfortunately.
I think we have some other significant internal problems. I'm still a practicing physician, and last March, April of 2020, I started prescribing hydroxychloroquine first for myself, my staff, then making attempts for friends and my own family, my children, etc. And that was shut down quickly. I was able to get it within a few days. It was shut down nationally. My daughter lives in Indianapolis. I started trying to get hydroxychloroquine then, but it was refused.
Was that from the pharmacists?
The pharmacists were refusing to fill it. And what happened in California, which is where I practice or try to practice, is that within months, the Medical Board of California said that licensees would be investigated if they prescribed hydroxychloroquine for non-FDA approved uses, which of course was COVID.
Yeah.
So it was stopped, and then the pharmacists stopped doing it. Now, I've also been prescribing as much as I can of the ivermectin, and that's beginning to get a lot of resistance from pharmacists. Many of them simply won't fill it anymore. I've still been able to get prescriptions for some of my patients and so on, using it prophylactically in some cases and actually therapeutically in others.
Okay.
So it's highly effective, as has been stated. And why there isn't this availability is striking. It is. It's unconscionable since it's around and it's safe, but there's a deeper motive going on here.
There is, and I mean, if you think about all of you physicians, how many drugs are used for off-label purposes, and it's perfectly fine. But in these particular cases, they had to clamp down on it.